Hi my dear students, now we can discuss about the second part of the chromosomal disorders. That is, now we are going to discuss about the other conditions like Edwards syndrome, Pato syndrome, Turner syndrome and Klinefelter syndrome. So first is Edwards syndrome or trisomy 18. Trisomy 18 or Edwards syndrome, or it is otherwise known as trisomy E. So it is caused, as in the name itself we can understand that it is because of the extra chromosome on the 18th chromosome. So trisomy 18, the incidence is 1 is to 6,000 to 8,000 live births, and the females are more prone to get trisomy 18 than the males. That is 4 is to 1. There are 4-time incidence among the females, and most of the die in the embryo. Most of them are die in the embryonic or fetal life. Then the risk factors are increased paternal and maternal age. Then prenatal screening. In prenatal screening, the good indicator is if in maternal serum during mid trimester have low human chorionic gonadotrophin and low unconjugated estriol. Okay, during the mid trimester, if the maternal serum consists of a low HCG and low UE or unconjugated estriol, it is a good indicator of this Edwards syndrome or trisomy 18. Then in ultrasound scanning, then if the anomalies are seen, amino or then CVS may be indicated. Okay, that is if the anomalies are can be seen through amniocentesis, or there is any cerebrovascular symptoms can be seen. Then there are 3 types of trisomy 18, that is full form trisomy 18, mosaic form trisomy 18 and partial form trisomy 18. Full form trisomy 18, mosaic form trisomy 18 and partial form trisomy 18. In full form trisomy 18, that is every cell in the body has 3 chromosome 18 instead of 2. Okay, that is all in all the full form trisomy 18 means in all the cells of the if you are taking all the cells, there will be the entire cell will consist of extra 1 chromosome on the 18th chromosome, and it is the severe form of trisomy 18 or Edwards syndrome. Then mosaic form. In mosaic form, the trisomy can be seen in only some cells. Okay, some sex in only some sex chromosome on only some cells only there will be extra 1 chromosome on the 18th chromosome, and it is less severe form. The next is partial form. Partial form means in some cells there may be an extra copy of part of chromosome 18. That means this chromosome 18 may be partially attached. It is not completely attached. So we can't say it is a complete trisomy. And the severity depend on the anomalies. So these are the 3 types. Full form is much severe because in each and every cell we can see an extra chromosome on the 18th chromosome. Then in mosaic form we can see the extra chromosome in some cells only. Then in partial form the 18th chromosome is attached to the 18th chromosome partially only, and it is the severity depends on the anomalies. Then clinical presentation are in prenatal history. In prenatal history, there will be the feeble fetal activity or less fetal activity. Then polyhydramnios, that means amniotic fluid index will be much higher than 24 centimeter. Then small placenta, the mother's placenta, the placenta that is attached in the uterus will be very small. Then single umbilical artery. It is one of the important indication of, actually there will be 2 artery and 1 vein on the umbilical cord. So there will be, if there is simple umbilical artery or single umbilical artery, it is an indicator of Edwards syndrome. Then post date means the dates will be extended for delivery. Then small for gestational age, that means the size of the child will be very small. Then weight, low birth weight in term infants. If the infant is term also, the weight will be much less. Then weak cry. Then response to sound. The response to sound is decreased. They won't respond to sound because of the hearing impairment. Then ears, there are lozate ears or abnormal shaped ears. Then mouth, there will be micronathia. Micronathia means what? What is micronathia? Micronathia, it is the small ear, small tongue. Okay, I have already told you micronathia. Okay, micronathia. Okay, micronathia means it is small tongue. Then other So other than Other than micrognathia, there is cleft lip, then cleft palate. So other than micrognathia, there will be cleft lip and cleft palate, then mental retardation. Then coming to the heart, there will be conditions like ventricular septal defect, then patent ductus arteriosus and atrial septal defect. We will discuss it in detail in the later chapters in cardiovascular system. VSD means ventricular septal defect. It is a presence of opening between the two ventricles. And patent ductus arteriosus, that is a ductus arteriosus will be stay as it is after birth, that is there will be abnormal connection between the aorta and the pulmonary artery. Then ASD or atrial septal defect means there will be an abnormal opening between the two atria. Then the feet will be rocker bottom, then big toe, then shortened and dorsiflexed, club feet, then crossed legs, then diastasis recti, then pectus carinatum, then GU defects. Then in GU defects, the genitourinary defects, there will be horseshoe kidneys, hydronephrosis and polycystic kidneys. Then hands, the hands will be clenched and with fixed fingers. Usually the index finger overlaps the third and fourth finger. Then flexion, contraction of the two middle digits, underdeveloped or absent thumb may be absent, simian creases, arches on the 7 or more fingers. That means there will be polydactylism. The nails will be underdeveloped. Then syndactyly means there will be absence of fingers. Then eyes, ptosis of one or both eyelids. Then epicanthal folds, head will be abnormal prominent occiput, and there will be microcephaly. Then umbilical and inguinal hernias. Then redundant skin folds, especially over the back of the neck. Then males, there will be cryptorchidism or undescended testis. Then prognosis is 20 to 30% die during the first month. Then 90% die by age 1. Then 1% chance of surviving to 10 years. Up to 10 years, there is only a chance of surviving up to 10 years. Then high mortality rate is caused by congenital heart malformation, gastrointestinal and genitourinary anomalies, then feeding difficulties, and associated central nervous system defects that produce a central apnea. Okay, so these are because of the associated malformations, there is a chance of high mortality rate. Then although they function with severe handicaps, all older children with trisomy 18 smile, laugh, interact, relate to their families and achieve some psychomotor maturation. They achieve some psychomotor maturation along with their families. Then mosaic cases may show milder phenotypic expression and prolonged survival. Then management. No treatment beyond the supportive care. We can give only supportive therapy. Then NG tube or then the NG tube or nasogastric tube feeding, then orthopedic management, then cardiac management, genetic counseling to the parents, parental support, then apnea monitoring or O2 if needed. So these are all about the Edwards syndrome. Next is trisomy 13 or Pato syndrome. Trisomy 13 is otherwise known as Pato syndrome or 13 plus syndrome, and it is caused by an extra chromosome on the 13th chromosome. So incidence is 1 in 5,000 live births, and the males are more affected than females. There is equal incidence for both males and females. The risk factors, it increases with maternal and paternal age, then increases with increased parity. Increased parity means increased number of children in one pregnancy or multiple pregnancy. And parental carrier of balanced translocation. If one of the parent is a carrier of translocation. Then prenatal screening, that is ultrasound scanning. If anomaly is seen, we can indicate that there will be any cardiovascular disorders. Then clinical presentation, they are severely mental and psychomotor retardation, ears are malformed and loss at ears, hands flexion deformities, there will be polydactyly, extra fingers, simian creases or clenched hands. Then in heart, there will be ventricular septal defect, atrial septal defect, patent ductus arteriosus, rotational anomalies or dextrocardia. Dextrocardia means the anatomical position of the heart will be on the right side of the chest other than the normal left side. Then eyes, microphthalmos, then colobomas of the iris, then cataract, then retinal dysplasia, then closed set. Closed set means there will be fusion of the eye with another eye. Then nose, broad and flattened, mouth will be cleft lip and cleft palate, hernias, umbilical hernia and inguinal hernia, there will be polycystic kidneys, Then cutaneous hemangiomas, then head. There will be dermal sinus on the scalp. There will be sinuses on the scalp. Then microcephaly, the head will be small. Then brain, gross defects, grand mal seizures, happening of grand mal seizures, microclonic jerks, jerking movements, seizures. Then hollow prosencephaly. So these all are the clinical presentation. Then the skin will be loose around the lateral and dorsal aspect of the neck. Then single umbilical artery, apnea. Then genitalia, female, that is bicornuate genitalia or separate, that means bicornuate uterus. That means I have already told that heart-shaped uterus. Then male cryptorchidism. Then mouth, cleft lip or cleft palate. Spine, there will be meningomyelocele. There will be rocker bottom of the feet. Then low birth weight, omphalocele. Then prognosis, 82% die within the first month. 5 to 10% survive till the first year. Survival to adulthood is rare. Common disorders if survive beyond 1 month of age. If they are surviving beyond 1 month of age, there will be disorders like severe mental retardation, feeding disabilities, then gastroesophageal reflexes, then slow postnatal growth, apnea, kidney defects, seizures, developmental disabilities and scoliosis. So management, there is no treatment beyond the supportive care and parental support. Next is Turner syndrome. Turner syndrome, it is otherwise known as monosomy X. It is a monosomy. It is the absence of one set of gene from the short arm of one X chromosome. Okay, it is in the X chromosome there are short arm and long arm. So if there is an absence of one set of gene from the short arm of one X chromosome, it is known as monosomy X. It is a monosomy. So Turner syndrome is a genetic condition in which a female does not have the usual pair of two. Okay, it is a female condition. It is a genetic condition in which a female does not have the usual pair of two X chromosome. And it was first described in 1938 by Dr. Henry Turner, an endocrinologist. So incidence is 1:2000 to 3000 live born females. It is happening in, especially in the females only. This Turner syndrome is happening in the females only. So 1:2000 to 3000 live born females, and the females are only affected. The 98% of pregnancies with Turner syndrome spontaneously abort. Spontaneous abortion is chanced. There is a high chance of spontaneous abortion. Then 10% of pregnancy that spontaneously abort have Turner syndrome. The risk factors: increased paternal age, then mother with mosaic or deletional Turner syndrome. Then Shox gene association. Shox gene provides instruction for making a protein that regulates activity of other genes. It is an abnormal gene. Then it is the most common monosomy, and it is a female phenotype, that is, it is happening mainly in the females. Presentation are short stature, mean birth weight, that is 2.9 kg, average height is 4 inch, that is 4 meters 7 inch. Then web bed neck, then low posterior hairline, micrognathia, okay, webbed neck, then micrognathia, then ears are lozate, sometimes malformed, prone to otitis media. Then widely spaced hypoplastic nipples on a shield-shaped chest. Then increased carrying angle at the elbow. Then heart, there will be coarctation of aorta, aortic valvular stenosis, bicuspid aortic valve, aortic dissection. This all we will study in detail in the heart. Then eye, there will be ptosis, strabismus, amblyopia, cataract, then epicanthal fold, dry eyes, red-green color, blindness. Then congenital hip dislocation, abnormal growth patterns, then congenital lymphedema of the hand and feet. In clinical presentation, continuation, there will be absence or retarded development of the secondary sexual characteristics, that is, they may not attain puberty. Then absent menstruation, the absence of normal vaginal moisture, infertility, gonadal dysplasia, horseshoe kidney, then unilateral renal agenesis, then intelligence, they are not at risk for mental retardation, better verbal than visuospatial abilities, then broad nasal bridge. Prognosis, the females are basically normal despite failure of sexual development. They are at risk for middle ear infection, scoliosis, arthritis, cataract, then Hashimoto's thyroiditis, kidney abnormalities, high blood pressure, obesity, then diabetes mellitus, osteoporosis, and keloid formations. Management, early supportive care, then surgery to correct the treatable defects, then late management include growth hormone therapy, estrogen replacement therapy, then counseling and psychiatric support. Then 2 to 5 percentage have some ovarian functions and can menstruate and become pregnant. Only 2 to 5 percentage. Then others can have children using donor eggs and in vitro fertilization. The next is Klinefelter syndrome. That means it is a trisomy of the 47th, there is a 47th chromosome, or it is otherwise known as 47XXY. That means they have extra chromosome. It is 47th chromosome. So it was first described by Klinefelter and Albright in 1942. The male karyotype with an extra X chromosome, and it is a male phenotype. It is mostly occurring in males. Then advanced maternal age may result in Klinefelter syndrome. Then clinical features are mental retardation, hypogonadism, gynecomastia. Gynecomastia means what is it? The presence of breast, formation of breast in the males. Then testis, penis and prostate are small in size. Secondary sexual characteristics fail to develop. That is, there is a failure in the attainment of puberty. Then decreased production of testosterone and increased production of estrogen in males. Then tend to be tall and have altered body proportions. Then increased risk of developing osteoporosis and Hashimoto's thyroiditis. May be shy, anxious, aggressive and engage in antisocial activities. It is much important. Then may have psychiatric and behavioral disorders, and it can be treated with testosterone by 11 to 12 years. The testosterone enanthate 200 to 250 mg every 3 to 4 weeks. IM should be provided. Then mammoplasty if needed. So these all are about the other chromosomal disorders like Edwards syndrome, Pato syndrome, then Turner syndrome and Klinefelter's syndrome. Hope you all have understood it, and if you have any doubt you can ask. Thank you.